And again, ask if you could please put your name and organization in the chat and keep your microphones on mute. If you have any questions, they, excuse me, may also be put in the chat. Let me just. All right. All right, I'm going to, I don't know why. 1 second. Sorry, I'm trying to get just the speaker on, and that's me. All right, we're going to just go back to gallery at the moment. Okay, we're going to get the meeting started, and we will hope that there are no further glitches. So the Delaware Association for Home and Community Care, or DOC, welcomes you to the launch of a home health and personal care services survey of providers of attendant care, companion, homemaker, home health aid, respite, and chore services. For those who don't know me, I'm Sue Getman, Executive Director of DOC, and we are the only association in Delaware representing organizations that hold personal assistance, home health aid, home health skilled, and hospice licenses. DOC offers information and resources, training, networking opportunities, and advocacy initiatives to promote and advance the home care industry in our state. Membership information, if you aren't already a member, is available on our website, dahcc.org. The survey being introduced today is a key component of a targeted rate review study being conducted by the Delaware Division of Medicaid and Medical Assistance, DMMA, with support from Mercer, that will examine reimbursement to direct support professionals who serve DMMA's Medicaid populations primarily through the managed care program. DOC believes completion of the survey by providers is essential to the development of reimbursement rates for the future. We're hosting the launch meeting to help ensure that providers understand both the importance of the survey and the information that will be requested. It's now my pleasure to introduce and pass the presentation to Drew Wilson, the Director of the Division of Medicaid and Medical Assistance. Drew?
Thank you, Sue. It's so nice to be here and very nice to meet all of you. My name is Drew Wilson, and I'm the Director of the Division of Medicaid and Medical Assistance, as Sue just said. I'm still pretty new here, so it's wonderful to see so many new faces and also a smattering of familiar faces. So I've been in this chair for about 4 months, but when I was in the chair for about 2 months, we did a town hall, so back in February. And so I first want to thank all of you who attended or were able to watch the recording of that town hall. And then I really wanted to thank I actually learned today that it's pronounced Doc, Sue. I didn't know that. So I always was just doing DHCC. So really want to thank Doc and much of your agency leadership at, for instance, Easter Seals and Jevs and GTI for giving just phenomenal feedback from that town hall that allowed us to really make sure that we get this survey as close to right as we can. We're very serious about using this as an incredible policy making vehicle. We think it's a great opportunity. And so, we really appreciate Doc for launching it today officially after some wonderful feedback, like I said. So very, very grateful for that. The next, I think it's 6 weeks, Mercer will get into the exact mechanics of everything and how this works, but the next 6 weeks are going to be so critical because really a core pillar of this to be a success is your input. So really, thank you so much for being here today. Please share this recording afterwards and share any questions you have. We are committed to making sure this is successful. And so again, thank you so much for all of your help to this point. And I want to actually hand it to Melissa Smith. Oh, there you are, Melissa. I was looking through to also share her thanks.
Sure. Thank you so much, Drew. And I echo certainly the gratitude of all of the participation, the input, and just the willingness to try to get this right. I'm also just grateful to Mercer and Medicaid for allowing us to tag along for the ride. As a non-Medicaid agency, we share so many of the same provider pools, so many of you we contract with. And so we're really happy to be coming along, learning and watching so that we can assure that we have equitable rates across our systems. And so I'm just echoing that thanks and happy to be here.
And then I think we're handing it over to Mercer. I don't know who's taken I see Leslie coming off mute, so take it away, Leslie.
Thanks, Drew. Hi, my name's Leslie. I'm from Mercer, as Drew mentioned. With me, I have my colleagues Holly Brown and Amy Korzanowski, and we'll be talking through the survey process today. So let me go ahead and share my screen. Let's see. Make sure sharing the right thing. Okay. So as Drew has mentioned, we did a launch back in February to initially kick off the survey process, but we received numerous amounts of feedback from the provider community and all very, very insightful comments. Helpful from your perspective, because you are the ones that are on the ground providing these services. So DMMA made the decision to kind of take a step back and let's revisit the survey, make sure we're capturing all the information that we need, and that we can take this new survey and move forward in a productive way for these rates. So let's see. So we did our introductions already. So today what we'll be doing is, again, talking through the project overview, what the purpose of this project is. We'll walk through the new improved provider survey, and then give you a chance to ask any questions and talk about the next steps. So for background, this whole project started as an initiative from DMMA as part of the HCBS spending plan. And what we're doing is conducting a payment study of the payment rates for these 6 targeted services revolved around payment towards like DSPs. And in this case, I know DSP is a term that's thrown around a lot, but what we're referring to when we say DSPs here is individuals who provide the direct care for these 6 home health and personal care services that we will identify. And DMA contracted with Mercer to conduct this review. What we'll be doing is looking at the current Medicaid payment levels in the managed care system. We'll be looking to gather input from stakeholders. This is the very important step that we're asking you to participate in. And then taking all of this information that we're able to gather along with publicly available data to conduct an analysis on the cost for providers to deliver these services. So the key project outcomes for this project is to better understand the costs associated in providing these services, and then to develop a rate range benchmark for the 6 services as a comparison to the current payments. On screen, I have the 6 services. So we're looking at attendant care, chore, companion, homemaker, home health aid, and respite. And you'll see that attendant care and respite have an asterisk because we recognize, based on the feedback we received from the last town hall, that self-directed services has a very different cost profile than the typical services delivered. And so in the survey, one of the biggest changes we've made was calling out self-directed services specifically to parse out the difference between the typical services provided and then self-directed. Here is a timeline of the project. So initially, towards the end of last year, we started looking at the services, like rates and the relevant legislations and regulations. We started looking at rate benchmarking methodologies that we've talked and discussed internally with the MMA, and then started developing the benchmark rate. And so when we say developing a benchmark rate, we wanted to look at all the publicly available data, like wage data, inflation, typical ERE costs, taxes, et cetera, everything that revolves around a cost to provide those services. And then, as we mentioned in February, we hosted a town hall and initially attempted to kick off the survey, received a lot of really wonderful feedback from the community. And so we made improvements to the survey based on that feedback. And now we're here in the second quarter of 2024 trying to launch the survey. The next steps will be taking the information that we are working on in the meantime, and then we will then we will take and consolidate the information we get from the provider survey to look at what adjustments we need to make in the rate models that we are currently developing. So this is all an ongoing process. And then after we collect, process, incorporate the survey data and incorporate it into our benchmark rates, we will put together a draft report discussing the rate study methodology and the final results that we see, and then be able to share what we find with you all again. And so just a special call out, because we did have a lot of, like I said, very wonderful feedback and very helpful to us to help us better understand the landscape of services that were involved. So just a few of the key contributors to making the survey a successful process.
The standout visits weren't going to room for Bridget King.
Melissa, can you please put yourself on mute? Thank you.
And so we're launching the survey today. The information will be sent out following this meeting. The survey will be due on May 24th, which will be 6 weeks from now, to hopefully give everybody adequate time to find the information and fill out the survey. This is on screen a snapshot of the introduction to the survey, explaining all the things that we talked about today. What is the purpose? What are we intending to do with this information? And then just some general directions. But we ask that you please complete the survey for your entire organization. That includes all locations in Delaware. And it'll be one survey per organization. Just wanted to call out that the survey will be one component of the targeted rate review. And so, like I had mentioned earlier, we are looking at globally what is available to us. So all the publicly available data, the Medicaid or the managed care data, and then also what we receive from the survey. And all of this will go into that rate buildup that we've been talking about. So what I'm going to do now is I'm going to flip to the survey itself so we can walk through what that survey looks like. So just give me one moment. Okay, so what I'm sharing on screen is the PDF version of the survey. And so we ask that you take a look at the PDF version, download it, take it back and do some homework to figure out some of the answers to these questions. And then once you are ready, you will click the link to the survey to fill it out for your organization. So this is the introduction, as we mentioned. The first section of the survey has just some general information on provider demographics. So your name, the provider organization name, and email address. The first 4 questions are optional, but would be helpful if, in case we have any follow-up questions or any additional feedback that we need from you, we can reach out. However, if you're not comfortable filling out your this information, the first 4 questions, that's perfectly fine. You can skip it. The next couple of questions in this section is just asking, which divisions do you provide services under, and then which licenses your agency holds. It is a select all that apply, because we understand that multiple locations can have different licensing levels. And so just please select all licenses that your agencies hold. The next section is general information. This is information that we know is very difficult to parse out by services. So we just have, as for your whole agency, you can answer these questions. So for instance, the first question is, on average, how many hours does a DSP staff need to work per week to be considered full-time? And that's not just service specific, that's just your organization wide. So all of these questions include things like full-time versus part-time, average wage, employee-related benefits, admin expenses, anything that your costs could be looked at on an agency level. Let's see. The next sections are the more service-specific questions. The survey looks very long. It's about 70 questions, but your organization does not have to answer all 70 questions. You'll only answer questions that are relevant to your organization. So the first question in each of the service sections will say, does your agency provide X service? So for instance, does your agency provide self-directed attendant care services? If the answer is yes, then a list of questions will pop up for you that you'll answer regarding those services. If you answer no, it'll skip to the next section so that you don't have to fill in anything for the services that aren't relevant to you. Self-directed has a little bit of different set of questions, but we're trying to get to the same points. So we're asking for average staffing ratios for these services. We're looking at the number of members you have enrolled for your services, the average hourly base wage, and then wages, including bonuses, overtime, any shift differentials, or any kind of incentives that you have for your employees. So that's what the rest of the section looks like. Again, it'll go through, does your agency provide this service? Yes, lets you answer the questions for the section. No, skips the section for you. I'm going to keep scrolling down. The last section of the survey gives you a chance to give us some additional feedback. So we have an open-ended question where you can list the top 3 concerns regarding your DSP workforce. So things like recruitment, retention, wages, things that we've heard from the community that are pain points for you. And then the last question is just any additional comments that you would like to share with us. Because we know that the survey does not capture everything, but we wanted to target the questions for cost-specific questions and then allow you to give us some, or give some space for you to share with us any other pain points that you have. I know I went through a lot of information very quickly. I wanted to make sure that we have some time to ask questions. So if anyone has any questions or concerns or comments right now, please feel free to jump in at any point.
Oh yeah, it's Richard Costa here at Four Seasons Healthcare. I'd like to ask a question, if that's okay. Sure. The rate study narrative has somewhat changed over the last few years. If you go back to prior to COVID, I guess we really didn't have the kind of staffing issues that we've got today. So one could argue that you could look at our costs and say, well, you're not struggling with hiring, therefore what should the reimbursement rate actually be? Because wages were relatively static. But what we've seen over the last 4 years is a rapid decline in the caregiving population, as those caregivers have not renewed their licenses or whatever, or have moved into other jobs. So really the narrative now surely is, what does it take to get people back into this industry? You know, what you talk about what the reimbursement rate should be, but that's presumably got to be partly driven by what is going to get, what's the number, i.e. the base hourly rate that gets a CNA to come back into this business or a caregiver to come back into this business. And I don't think we know that. So my question is this, how are we going to find that out? And is this part of the study?
Yeah, absolutely. I mean, that's feedback that we've heard in everywhere because it is a struggle, the workforce right now. And so the survey initially asked for cost information because we want to get a baseline of what the costs are, but we are taking into account things like we know in January minimum wage will be increasing. And so what's going to happen is we take all of this information that we gather, the basic cost information from the providers, what we've been able to find publicly, looking at the rates from the Medicaid managed care organizations. And then we're going to apply things like policy, like the minimum wage increase, any incentives that DMMA wants to put forth to help bolster the workforce, if that makes sense. So it's not just taking, these are your costs that we see, and this is the rate you're going to get. We're going to take the costs that you see, and we're going to build up a rate range that tries to incorporate as much of what the current landscape of services looks like as possible. And that's where that last two questions, it seems very minor because it's just two questions, but it's very helpful for us, because if you tell us we're having a really hard time holding on to CNAs right now, we're having a really hard time recruiting, direct support professionals. Those are things that we can try to reflect in the rate once we build it up. Was that helpful?
Yes, it was. And I just make one other comment very briefly. You talk about current rates. We don't actually know what the current rates actually are.
Yes.
We know there was a rate increase last year, and we're waiting to hear that. So I think we've got to be mindful that when we respond to this survey, we know exactly what the rate is. And hopefully we'll know that soon.
If I could, this is Robert Nelson with Addis Healthcare. I agree with the gentleman and what he's talking about. I think there's a secondary part of this, and that is the cost for employees to enter healthcare. You had a pretty significant increase in background checks. There are physicals that need to be done. There's a shortage of RNs. We do skilled care and home health at Addis. And I think these are complicating factors as well. You work at McDonald's, right? So why enter back into healthcare when your out-of-pocket expense, and we cover some of it, TB tests are extremely expensive. And, even the physical part on the healthcare side is challenging for people. How to get an appointment, you got to pay for it. And so I think we need to look at, in a more broad-based way, what are we doing to attract people back into healthcare? And, I think we need to look at regulations, limiting LPNs from doing supervisory visits. So I think, the rates are great. I agree. But I think in a more macro view here, we really need to look at what the gentleman, I apologize, I don't recall your name. I thought it was a great point. What are we doing to attract people to come back to healthcare?
Yeah, absolutely. And of course, I don't want to speak for DMMA. So Drew, if I misspeak at all, please jump in. But this is just one part of like a broader initiative, right? We have the HCBS spending plan that DMMA is working with. And so we are focused on, at least as somebody had mentioned, establishing a rate range first for what these services at a baseline should be covering, right? And then moving forward from there. I know that the rate study is not going to solve every problem, but it starts somewhere to help us on the path of getting a standardized rate out there so that policymakers and other pieces can be moved as well.
Hello, my name is Felicitas Ategan, and I am from Caritas Home Health Services. It's just to add on to what Mr. Nelson said. So we actually have a problem hanging on to our personal care attendants or recruiting more because, they have a lot of questions about all of these other things they need to do. For example, we have this new communique about having their background check done for every job they apply to. I don't think that is okay. It doesn't sit well because a CNA or a home health aide who goes to do the training, they do a background check before they get into that training institution. And 3 weeks later, they leave with a home health aide certificate. And by the 4th week, they are looking for a job. And yet they are required to go do another criminal background check. So please, I think they could look into all of this in order to help us, the employers, hang on to their employees and recruit more employees. Thank you.
If
Can
I
I
could
just
just
add-
jump in, Sorry, if I could just, this is Sue from Doc. These are some of the issues that Doc is looking at, especially around the background checks, fingerprinting, things like that. And so if you would like to connect with me, I'll put my email in the chat and we can talk about those issues. I know this specific study is related to the rates, but you're bringing up some excellent points and things that we're very concerned about: workforce recruitment and retention, the barriers to those things, which include the background check process. So please, like I said, I'll put my email in there, and if you want to talk further, we can do that. And I do have a couple of questions in the chat, Leslie, if I can direct those to you.
Sure. And before we do that though, I do want to say like this kind of feedback, like the more qualitative feedback, that's what the last two questions in the survey are for, because we do want to just help improve the system as a whole. Our rate study is focused on rates, but if we can get some of this qualitative data, then we can give that over to DMMA to allow them, you know, like actually documented data about the struggles that providers are facing. But yes, we can move forward to the other questions.
Okay, so a second here, just putting my email address here. Okay, Amy asked, are you interested in capturing survey data from companies that do not bill Medicaid, strictly private pay, so billing codes are not used?
So I think Amy or Holly, jump in if I am misspeaking, but I think that we want specifically under Medicaid services, the population we're targeting, because costs I think look very different, private versus public, right? So we want to make sure we capture the services under Medicaid.
Okay, thank you. And Anthony wondered where the PDF can be downloaded.
Great question. So after this meeting, all of the resources, the video recording, the PDF, and the link to the survey will be posted on DMMA's website, which will be shared at the end of this meeting. And then I think also we're intending to send out the information. Is that right, Sue?
Yes, I will send it out to the doc membership. Those of you who are not members of doc, and I know there are at least a few of you on the call, again, please email me and I can send it to you directly.
Are there any other questions
I would just
at
call
this
out,
moment?
I would just call out, there was a comment in the chat about, and just the feedback of the increase of costs with background checks and other indirect costs. There is a specific question within the survey related to other things that you're experiencing regarding licensure, background checks, other EVV related expenses, just to get kind of a picture of how things have changed in the landscape, so we can pull all that information in together as well when we're building up the rate. So there is a specific question in there as well to provide that information. Just wanted to call that out because that was some great feedback along the way. We did incorporate that.
I'm just scrolling through the chat to make sure we didn't miss any more questions. Yeah, if you have any other questions, please feel free to ask them. Let's see.
There
So
was,
oh, sorry,
I was going to say there is Amy did comment that the costs for hiring and maintaining are the same, and that her reason, I know others share this reason for not becoming a Medicaid provider, is that providers cannot afford the low rate of reimbursement along with those other costs.
Sue, I just want to make sure that your email in the that you just put in doc.director@gmail.com or .org. You're on mute.
Thank you. Well, I'll put it in. Oh yeah, sorry. I'll put it in again. Here's my correct one. Thank you, Rob.
I see a question that says, have you looked at the VA rates for the CCN and how they have determined how they have created their reimbursement rates? If I'm understanding your question correctly, if we're looking at other state benchmarkings essentially, or how they develop their rate study, we again are still gathering our data to create the rate model. And so I'll make a note to make sure that we take a look at that study. Okay, so I'm going to talk through the next steps. But again, if you have any questions, please feel free to ask them. So the provider survey results will be reviewed by us. And if you have provided contact information, if we have any questions or follow-up on the survey responses, we will reach back out. The presentation, a PDF of the survey, and then the link will be posted on the state site that's listed on the slide right here. And then upcoming for after all of the information has been consolidated and analyzed, we hope to host another town hall to share the results of the rate study with everyone. We want this process to be as transparent as possible, and we really do appreciate all of the feedback and information that we've gathered, and it really just helps us understand the challenges and what the landscape of services look like in Delaware. I did want to call out one more thing, going back to the last slide. If there are any questions that you think of after today's meeting or while you're filling out the survey, there is an inbox, DMMA-DSP rate study at mercer.com, where you can send any kind of questions you have, or if you're having any tech issues or anything like that, please reach out to us and we will respond as soon as possible and help you get through this process.
Leslie, just to confirm, this is Rob from Bayada. Just to confirm the timeline, the survey will go live sometime today or first thing tomorrow or something like that.
Yes.
And then we will need to respond by May 24th, right?
That's correct. Yes.
Okay, just wanted to make sure.
And I see that Drew just posted the website link in the chat. Thank you. And I know that we'll share this out after the meeting as well.
Allison also commented that getting data from agencies that don't provide managed care is also important, since many agencies accept both private pay and managed care. Knowing where their rates are is key, as private pay will take from managed care if the rates aren't competitive. Any other questions that anyone has?
Well, let me be the first to say, though, that we're really appreciative of the inclusiveness of this process. I've certainly heard stories of it not being as inclusive, and I think it's mutually beneficial. I think you're going to find that your data will hopefully be more robust and detailed and really paint a truer picture. And for us, it gives us the opportunity to really have a sense of your understanding of our local market and help ensure that we're all on the same page about what the data is hopefully going to report, not hopefully in terms of the content, but hopefully that the data is as we expect it and hope it to be so we can really move the needle on these and be in line with where the market says we should be. So thank you.
Yes, absolutely. And we really appreciate all of the participation and how active the provider community is, because it does help us get the information a little easier. And I did also want to address the comment from Allison. We are right now targeting the rate study towards the managed care population, but if your agency provides services under DSAPID or any other divisions, we do want that information as well, because we're looking at trying to create a standardized rate range. And then we've been told that the information that comes out of the study could potentially impact policy in other departments. So if you provide services under agencies or divisions outside of DMMA, but still for the Medicaid population, please fill out the survey.
All right, last call for questions or thoughts. I want to echo what Rob said about appreciating the opportunity to collaborate and work together. We're all trying to serve people in the community as effectively as possible, and the results of the study, we believe, will help us do that.
Absolutely. At the risk of not giving the host the last word, so feel free to jump in after I say this. But
you can have the last word.
No, it's completely fine. First off, really thank you everyone for your time today and your engagement with the survey. We certainly do hear that we don't want to lose the forest through the trees, that we do share a mission at Medicaid and with the provider community, where we really all care about the members, clients, patients, beneficiaries, whatever term you want to use, the 270,000 Delawareans, which are rapidly entering into a need and growing need for HCBS services across the board. We all have them first and foremost in our minds. And so we're very grateful for the partnership and the shared mission. And I'm very much looking forward to working with all of you as we not only work on this one sort of narrow piece, but as we keep an eye on the global. So really, thank you so much for your help with this. This is such an important part of a larger conversation. And Sue and Doc, really, thank you so much for hosting us. And Melissa at DSAPID, thank you for being here as well.
Thank you. And I hope everybody has a good rest of the day, and we'll complete your survey soon. All right. Thank you.
Thank you.
Thank you, Sue.
Bye-bye.